I'm James O'Brien, physical therapist, and in this video, I'm going to teach you the exercises and the habits that I use to successfully treat most of my patients with knee pain. So let's get started. First off, we need to understand that the knee is not just a hinge. The knee also has a fair amount of rotation to it. You can see here, as I'm bringing my foot out to the side, this motion actually isn't coming from my foot and ankle, but rather the lower half of my knee, the tibia here. All right. Often people are sitting like this, or they're walking with their toe pointed out to the side as their knee comes forward. Or maybe they're performing a squatting exercise with their toes out and their knee collapse in. In any of those cases, when we have excessive amounts of external rotation here, that creates a faulty twist at the knee, and that can lead to a variety of types of knee pain. It can pull the patella out to the side to make pain in the area of the kneecap. It can lead to a torn meniscus, a torn ACL, if something forceful happens. So all bad things. So we want to start to get into the habit when we sit, when we squat, when we walk, to ensure that our knee lines up with our toe. So if I'm sitting correctly, you can see here that my knees are lined up with my toes. If my toes point out to the side, that's okay. My knees just better go out with it. So if I'm performing a squat and my toes are out to the side, I need to ensure that my knees go out with it, over the toes. All right. But I prefer, generally speaking, to keep my toes mostly pointed forward. And that's important for activities like walking. As I'm walking correctly, if I walk with my toe pointed forward, my knee drives forward, it stays in line. If I start to walk and my foot points out to the side like this, I can create a twist every time I take a step. That leads to a faulty twist. That leads to a lot of problems. To reduce and prevent knee pain, it's very important that you learn to walk correctly. And the real trick to walking correctly is to trick your body to using these big these buttock muscles. These buttock muscles are so important. And in fact, in a few minutes when I show you the exercises to truly address and reduce your knee pain, it's predominantly just strengthening up your glute muscles. But we want to trick your body to using those correctly, because if we don't use your body correctly, that's how we get hurt. So your glute muscles, because they take your leg out to the side, those same muscles basically prevent this from happening. Now, the muscles in your body work similar to a rubber band. When we take a rubber band and we put it on stretch, when we let go, it contracts. All right? Your muscles work the same way. For example, I can't jump high unless I put those muscles on stretch, and then I can jump much higher. If I don't put my glute muscles on stretch correctly, I can't use them. Because one of the motions that they do is this, if I'm walking with my legs wide out to the side like this, they're not being put on stretch. I'm not going to use them correctly. But that's where I see many people walk all the time. Our glute muscles also externally rotate us like this. So we already know that if we're walking with our foot out to the side, how that can create a twist at your knee. But also, if we're already externally rotated, we're not going to engage those glutes so much. That's another way we promote knee pain. This motion here is almost the same as this motion here. And often if an individual is weak in their hips or they just have a bad habit, they might walk like this. This is also another method that shuts off your glutes. So in my opinion, the best exercise or the best mindful exercise to improve your walking technique is to pretend that you're balancing something on your head. You can actually take a book or a rolled up towel and put it on top of your head. And if you place it there and you balance it there as you walk, it's going to clean up most of the faults that I commonly see. All right, but if we want to get picky, we want to truly learn all the right technique, here are the cues. So first off, of course, we need to keep our toes forward. All right, we already talked about why. Next, we want to take that stance, we want to make it somewhat narrow. Next, we also want to take a shorter, quicker stride. If we take too long of a stride, when our foot lands way out in front of us like this, I'm going to try not to fall. When our foot lands way out in front of us like this, as we strike the ground down and forward, now the ground pushes us up and back. And that creates a braking effect, which creates impact at our knees. So instead, we should be landing with our foot closer beneath our hips And here we're not being pushed so much backwards, but rather more upwards. So by taking shorter, quicker steps, like I'm doing here, it's actually much more efficient than if I were taking these big, long steps. All right? And to be quite honest, when I take big, long steps like that, barefoot, as humans evolved, on this hard surface, it actually hurts my foot. Okay? So I would encourage you, practice that on your own. Take your shoes off, see what it feels like to walk correctly with that short, quick, narrow stride, and then with these big, long steps. And I think you're going to find out quickly that when you take those big, long steps, it hurts your foot. All right? Lastly, often as I'm teaching people proper posture and to take that short, narrow, quick stride, often people walk like robots, like this. Okay? So as I mentioned before, one of the functions of your glute muscles is they externally rotate your hip, like this. All right? So when we walk, we don't actually do this as if we're on skates, but we want to harness the power of that external rotation. So how do we do that? Rather than rotating the ball within the socket, we rotate the socket on the ball through what is called pelvic rotation. So rather than walking like a robot, what we do is we allow for that natural pelvic rotation, which creates the twist that we see with walking, and that helps us better load our glutes. So you can see here I'm walking with nice pelvic rotation. So we want that short, quick, narrow stride in good posture, as if we're balancing something on top of our head, allowing for that nice pelvic rotation. So before we dive into the exercises, I think it's very important that you understand why we're going to be doing these exercises. So here it is. So basically, one of the main drivers of knee pain is weakness here in the buttocks, specifically these side buttock muscles. These muscles get weak in almost everyone because we do a lot of sitting, okay? And even if we are working out, many of us just work out on two legs. We're doing exercises like squats or deadlifts, all right, where we're on two legs, and those muscles that stabilize us and keep our pelvis level when we're on one leg don't need to work. So I've had patients that could even deadlift 600 pounds, and when I test their hip, it's extremely weak because all their workouts are on two legs. So how does this cause knee pain? How does weakness here cause the knee pain? Well, first off, if those muscles are weak, all right, and we go to jump, we might get a collapse like this. Or as we're running, it can collapse because those glute muscles cause that motion. So when our knee gets out of alignment, as we talked about earlier, that's a major factor in knee pain. So that's one of the reasons. The other reason is an imbalance between two muscle groups. So if this muscle back here is weak, known as the posterior gluteus medius, another muscle here in the front called the tensor fasciae lata takes over. So basically, if this guy doesn't do its job, this guy takes over. Right? Because something needs to stabilize us when we're on one leg. However, when this becomes overactive, it can be a major factor in knee pain. And here's why. This TFL, tensor fasciae lata, ties into this big band known as the IT band, which goes down the side of our thigh. That band ties into the side of my knee, and if it's overactive, it can pull my knee into that faulty external rotation. Also, because everything's connected, if this is tight over here, well, some of the other tissues and fibers that come over to the kneecap can be pulling the kneecap out to the side. So if this over here is tight, the kneecap can get pulled out to the side, and the kneecap doesn't travel in its little groove as it goes out to the side. That makes knee pain. So how do we address it? Well, first off, we just simply get these muscles stronger. That's number one. Number two is we can massage this in here, okay? And if we massage it aggressively, it'll get it to calm down. And that moves things in the right direction, but it's not really the permanent fix. The real permanent fix is getting these stronger. But that's really not enough. Then we actually got to use that strength. And how do we use that strength? We walk correctly. So let's now dive into the exercises. Now, as I mentioned, to get this side muscle here, your lateral quadriceps, as well as your iliotibial band to relax some, massage is a great method. And I think the best way to massage it is with a foam roller. But let's talk about how massaging it might actually help. Okay, so if we look at this rubber band, you see when I stretch right here, it stretches out very nicely. Okay, now let's look where the knot is. When we go to stretch out where the knot is, we try and stretch it out, everything stretches but the knot. So if we want your muscles to work correctly, we got to bust up the knots. So as we bust up the knots through some aggressive massage, things start to stretch nicely. So muscles work better when we don't have a lot of knots. And foam rolling is a great way to address that. I'm just going to warn you, if you've never done this before, this could be very painful. All right, and if it's too painful, maybe don't use the foam roller. Instead, take your hand. You could even take something like a broomstick and start to just massage here. If you're doing it correctly, it should hurt some. And we're going to look all the way from basically here down towards the side of your knee. So this is a very small foam roller, but typically most foam rollers are 6-inch in diameter. This is about 4. Okay, so this one's a little trickier to use, but that's okay. So what I'm going to do is I'm going to get on my side. If I want to do my right side, I'm going to take my left leg and I'm going to cross it over like so. I can either go off my hands or I could go off my elbow like this. And what I'm going to do is I'm going to search around in the side of my thigh for areas that are painful. Okay, and this is all about discovery. And I'm just going to warn you, again, this could be very painful, but I've never had someone harm themselves doing this. And I've done this with hundreds, if not thousands of patients over the years. So we look for those areas that hurt. If you want to get a little bit more aggressive about it, if you find a spot that hurts, you can bend your knee back and forth like this. That might be even more painful, but again, it's not going to harm it. You can also grind out some areas. And you can get a little bit more to the front of that hip here. So notice how I'm really searching around. If I find a spot that hurts, I can sit on it. I can slowly roll it out. I can bend my knee back and forth, or I can grind it out like this. And I usually have my patients do about 2 minutes per side. In time, this will get progressively less painful. As you start to get your glutes stronger, as you start to perform this regular massage, it'll get much less and less painful. So I'd encourage you to consider to try this right now, either with your hand or a foam roller for 2 minutes. Next, I'm going to take you through my 4 favorite hip strengthening exercises. These are the real money makers. And thank you for being patient, but I'll tell you, if you're moving correctly and you do these 4 exercises in particular, not only are you going to likely feel a whole lot better, I can't make any promises, but you'll definitely get stronger. So to do these exercises, you'll need to get a resistance band, a loop resistance band. This was just some basic black TheraBand that I tied in a knot and made a loop. However, there's lots of different prefabbed or pre-made loops bands out there, really to strengthen up your hips. If you looked for a hip loop, you could probably find some. So what we're going to do is we're going to take the band and we're going to place it just above our knees, like so. And the first exercise we're going to do is a bridge. So when we do the bridge, what we want to do is we're going to lie on our back with our knees as bent as much as possible. I don't like people doing bridges here, but rather getting our feet as far back as possible. We need to make sure that the toes point straight forward like this. Toes are pointing straight forward. My feet are apart, my knees are apart. And you want to keep your knees apart the entire time. I know it's going to get tiring and you might want to bring your knees together, but I want these exercises to be tiring because, of course, that's how you get stronger. So to do the exercise, we're going to lift our hips up in the air and you want to squeeze your butt very tightly together. You're going to hold 1, 2, 3, and then down, then go right to the next. 2, 2, 3, and down. 3, 2, 3, and down. I want you to do 20 total. For all of these next exercises, you're going to hold for 3 seconds at the top position, do 20 repetitions. Now, a big error with this exercise is when people lift up, they hyperextend their back like this. And that's a great way to make back pain. So instead, you can tighten your abs a little bit and squeeze your butt very tight, like so. Notice here I'm lifting through my hips. Here I'm hyperextending my back. All right, so try not to do that. Even if you do this exercise perfectly, there's some individuals who kind of have a bad back to begin with. Even if they're doing this exercise perfectly, like I'm doing right now, it still might aggravate your lower back. So if this exercise hurts your back, it's probably not the one for you, okay? But if it doesn't, it's actually probably good for it. All right, the next exercise is the clam exercise. So when we do the clam, you gotta be very picky with this. I see people do this exercise wrong all the time. And unless you do this perfectly, you're really not going to get much benefit. However, if you do it perfectly, you're going to get a ton of benefit. So to do the exercise, we're gonna have our hips more or less at about a 45-degree angle here. We could do it up high, we could do them within line with our body, but I usually go give or take 35, 45 degrees here. My knees, I want them bent to about 90 degrees. Next, what I need to do, and this is the real important cue, I need to take my pelvis and tilt it forward. It's as if I'm bringing my lap down to the floor like this. I can even draw my belly button in a little bit. That just gets my core activated. From this position, I could keep my hand here, or I could keep my hand up here on my hip. I'm going to separate my knees, but my feet stay together. Don't take your feet apart. Separate the knees, keep the feet together. And the real trick here is to keep the pelvis in a forward position. This is the big error that everyone does. Even when I explain this to them, I can't tell you how many times I see people just doing this, and you're not going to get a great workout. However, if you think about pushing that pelvis forward every time you lift, it won't roll backwards. And when you do this correctly, you're going to feel a nice contraction in the side of your butt, somewhere on the back side in here. If you feel it more in the front, that means you just need to roll even more forward, because it's very important that you feel it on the back side. So just like the other exercise, you're going to hold 1, 2, 3, 2, 2, 3, 3, 2, 3, 20 times on both sides. Don't just do the injured side, do both sides. That way you stay nice and even. The next exercise is a tough one. That's the single leg bridge. So when we do a single leg bridge, we're going to take the band off. We're going to lie on our back. It's similar to the bridge, but we're going to be doing it off of one leg. So what I like to do is I always make sure I have good traction so my feet don't slip. That's why I put my sandals on when I got on the mat here. If you slip, when you pull back, you might get a cramp in your hamstring. So what I do is I take one leg up in the air like this, and I take this kind of close to my chest, and that helps reduce the chance of me hyperextending or overarching my back. And I simply lift up. 1, 2, 3, 2, 2, 3, 3, 2, 3. And you want to perform 20 repetitions, okay? A big error with this exercise would be, again, hyperarching your back like this, or if your foot was out to the side like this and your knee was out of alignment. So again, you need to make sure that your toe and your knee line up, and that as we lift up, we don't hyperextend the back. It's very common when people do this exercise, if their butt is shut off, that they'll get a cramp here in their hamstring. And here's a little trick to prevent a hamstring cramp. Think about pushing your foot down and forward as if you're pushing your head that way. So as I push down and forward, that activates my quad, which helps inhibit my hamstring some to get me to use my buttocks. However, if you're still doing the exercise and you're still getting a cramp, don't hold it, just go up and down. But in time, as your butt wakes up, you should be able to do the exercise without hamstring cramping. Again, you're gonna do 20 repetitions, holding for 3 seconds, as long as you're not cramping, on both sides. The last exercise is the side lying leg raise. When we perform the side lying leg raise, we're gonna get on our side. We don't wanna be propped up like this. Instead, we wanna get nice and flat like this. That keeps our spine more straight so we don't get a pinch. We wanna make our body nice and long, okay? Often people are doing this exercise here. No, I wanna see that everything is straight. So a nice cue for that is to push your head away from your feet. That will make you nice and long. Next, just like the clam, we want to take our pelvis and we're going to roll it forward, okay? That's going to trick us to using our buttock muscles. We can draw our belly button inward. That'll help protect our lower back. We can then squeeze our butt. That's going to wake our butt up. And then we're going to lift up and just slightly backwards. When done correctly, I feel a nice contraction right here on the side of my butt. Don't take your leg way back like this. If you take your leg way back like this, you might be hyperextending or overarching your lower back. That's a great way to make low back pain. We prevent that from happening in part by keeping our core tight. So our core is tight, our pelvis is forward, our buttocks are squeezed. We lift up and just slightly back. We feel a nice contraction here. We can even push not out through our toe, but if we push out through our heel like this, that'll further help you activate your buttock muscle. Just like the other exercises, we're going to hold for 1, 2, 3, 2, 2, 3, 3, 2, 3, 20 times. Now notice I'm not going up very high. That's all the flexibility I got. Now if I cheated and I did this, like I see most people do, I don't feel anything in my butt, and instead I feel it in that tensor fasciae lata muscle, which ties right into the IT band, which makes the knee pain. So we don't want to overstrengthen that muscle, which is already probably overactive. Instead, no, we need to trick that body to using more of the butt muscles. All right, guys, so that's basically it. The 5 exercises that we did were the foam rolling and the 4 buttock exercises. The double leg bridge with the band, the single leg bridge, the sideline leg raise, and the clamshell. I apologize I didn't show you them in that order. However, there's 2 other exercises, if you want to stick around, that I do for myself personally that are great, that I've also used for other people. And if you had a hamstring strain or maybe even a little bit of groin pain, these are also some great exercises. So the first is the straight leg raise, okay? So very simple exercise. When we do a straight leg raise, okay, we're taking our leg up, but we want to get a little bit more picky than that. What we want to do first is we actually want to activate our deep core muscles. So to activate our deep core muscles, what we do is we flatten our back in to the floor as we draw everything inward. Now this can be a little bit tricky for people, so I'm going to show my belly here. So a great cue to get that to wake up is if I push out my stomach like this and I arch my back, that's bad. We want to do the exact opposite. I'm going to draw everything in as I flatten my back down, and I basically want to stay there. Then I'm going to perform my straight leg raises. And for these, I like people to shoot for anywhere from 20 to 30 reps. This is going to activate your quadriceps and get your hip flexors working a little bit. It's a great exercise. I call this next exercise the hamstring exercise. And basically what it does, it activates your hamstring in its shortest position while it stretches out the front of your thigh. So we're getting a gentle stretch to the front of your thigh, to your quadriceps, and it's also strengthening the hamstrings. So here's how it's done. I lean into an object like this chair here, and what I'm going to do next is I'm going to take my right leg, if I'm working the right side, I'm going to take it back as far as possible without arching my back. So my thigh goes back as far as possible without arching my back, and I keep my leg close to my side. I'm not going to take it out like this. From here, I bend my knee. So it looks something like this, just back and forth like this. And this is going to work that hamstring very nicely. This is a wonderful exercise for individuals who've had a hamstring strain, but often people strain their hamstrings because their butt is weak. So of course we do the other 4 exercises, the double leg bridge, the single leg bridge, the clam, and the sideline leg raise, but I also add this one to the mix. And for this, I usually do about 30 repetitions. And of course, we're going to do that on both sides. That's the hamstring exercise. Now, I realize this was a very long video. However, if you're looking for a short reference guide, a video that's under 3 minutes in length, which basically summarizes all the points of how to walk correctly, what to avoid, and how to do the exercises correctly, check out this video right here. If you have any questions, please consider putting them in the comments below. I'll do my best to address them. If you like this video, please give it a thumbs up and feel free to subscribe to the channel. All right, thanks guys, and we'll see you next time.